Morning everyone, my name's Jonathan. I'm a community pharmacist in Stirling and I'm currently the chair for the Royal Pharmaceutical Society in Scotland. Just about to open up the pharmacy this morning and I thought I'd record a short message for you guys just to update you on some of the recent activities that RPS has been working on to try and help us all with our practice in these unusual times. So I'm going to focus today on a piece of work that we've been doing around professional and ethical dilemmas. Very recently, RPS set up a short life working group chaired by Dr. Matthew Boyd from University of Nottingham and the Pharmacy Law and Ethics Association to bring together experts from around the profession and indeed outside the profession as well, to try to come up with some solid guidance for all of us to refer to when we're making some of the really difficult decisions that we're going to have to make over the next coming weeks, and indeed that we've probably been making already. So I just wanted to talk through that with you, just to let you know what's on the website and encourage you to go and have a look at that. So the working group itself, and I think it's important that we highlight this, the working group really did bring together a wide range of individuals. So we have people from GPHC, we have people from the schools of pharmacy, from the Nursing and Midwifery Council, we've got legal experts on that panel, hospital pharmacists, community pharmacist representation as well. Importantly, we have some of our consultant critical care pharmacists on that group, and also, interestingly, people from the Army Medical Corps. So you can see the angle that we're coming at here is to bring people together who are very experienced with dealing with crisis situations and really bringing these ethical and professional dilemmas into focus. In terms of what the document actually covers, and you can just log on to the website, go to the COVID-19 page on the RPS website, and it's all there to see and to download. But just to briefly talk you guys through what the sort of the headline content is there. It's about maintaining patient safety, how you do that in these difficult circumstances, what to do when you're working outside your normal areas of expertise and competence, allocating scarce supplies of medicines. That's a really important focus because we're all dealing with medicines shortages, be it in primary or secondary care at the moment. And that also leads to conversations about procurement, the distribution of medicines and supplies, possibly even the repurposing of medicines if they're out of date or returned to the pharmacy. There's guidance there about following legislation, but possibly being more flexible around that, and the record keeping around that as well. It also deals with direct and indirect discrimination in your decision making, so it really makes you reflect on how you make your decisions and how to make those in a fair and equitable way. It also highlights moral distress, PTSD, and some issues around that. And there are also some conversations about managing patients remotely as well, which is something that many of us are having to take on more than ever before. It also highlights some of the core issues around leadership, around research during these times, and learning and improvement strategies as well. So it really does cover all the angles on this, and I would encourage you to log on to the RPS site and have a look at that. Through this document, it continually refers to our Medicines Ethics and Practice Guide as well. So the good old MEP, whether you've got it in hard copy or whether you're logging on to view it, that is still an absolutely critical and essential document at this time. And for pharmacists and technicians who are not currently RPS members, you might be aware that you can now log on to the site and you can access the MEP and you can access our most popular professional guides, as well as everything else on the COVID-19 pages on the RPS site. So although it's not hard copy, you can log on and you can view the MEP, and I think that's particularly helpful for people who are moving sectors, moving into new areas of practice, or indeed are returning to practice, having been off the register for a period of time. So please, guys, make the very, very most use of that. The MEP is a fantastic resource. Before I go, obviously I'm in my community pharmacy here, but I just wanted to give a massive shout out to everybody in the hospital service at the moment working in the aseptics units. Those of you who know me well know that I spend quite a lot of time on Twitter, and one of the things that has really really hit home with me over the past few days is, and thank you for sharing this, guys, but is all the people in aseptics units who are breaking down those thousands and thousands of ampules and doing all those dose calculations so that it's saving our doctors and nurses on intensive care units the time doing that. You know, I bow to your expertise and knowledge, guys. It's just absolutely fantastic work. So thank you very much for that, and have a good day, everyone.